But as temperatures continue to rise, there's one important thing we want to talk about. The COVID numbers are going up as well. The uptick is happening as summer travel is on track to break records. And we have Dr. Gary J. Sheppard, former president of the Harris County Medical Society, joining us right now to talk about this, some of the safety measures that we can take and just other ways to stay healthy. Doctor, thank you for joining us this morning.
You're welcome, Brittany. Glad to be here.
You and I were talking before the show. So many people right now of all ages really dealing with this. COVID cases. Why are we seeing that spike right now after flu and cold season?
Actually, something we've seen every year of COVID.
Okay.
During the summer, there's another spike. We sort of expect it, and it'll come up. Usually about July, August, we'll see the spike. The difference this year is it's early.
Okay.
We usually are seeing it, as I said, mid-July or so, but now it's actually starting now. The ID guys are saying, well, maybe it was because of Father's Day and travel. You had Memorial Day, you have high school graduations, and of course, people are starting to travel now.
Right.
So all of those things are sort of coming together to cause an extra spike.
Well, and we are just getting very close to the 4th of July holiday. We know this weekend is going to be one of the busiest travel times. What do you tell folks if they're getting ready to go to a family affair or maybe get on a plane? What are some precautions they can take?
Unfortunately, at this point, people aren't able to get their vaccination, which is one of the things you want to do in the fall, or you can get it any time during the year. They have these new variants out called FLIRT is one of the things which people read about and hear about. And they have some little tweaks compared to the previous Omicron, but the vaccine still works. Right now, though, one of the things we say is mask up. I know people don't like wearing masks, but when you're on a plane and there's a lot of people around and you're inside at gatherings, that's going to be the safest thing that you can do currently in order to try and protect yourself.
And doctor, you were talking about this new variant a little bit different. What are some of the symptoms, I guess, that we are seeing? Is it the traditional, what we hear of when you think of COVID, or what are you seeing with patients right now?
The symptoms are similar to what we've had before. You have fever, you have a cough, nasal congestion. Those are the most common. We're not seeing as much of the lack of smell, lack of taste that we were seeing at first. We're not seeing that as much. But for most people, cold, cough, fever, the nasal congestion, drainage, those are the things that people get. The problem is they're similar to all of us get the summer cold.
A regular summer cold, yeah.
And with the rain, of course, people's allergies are kicking up. So it confuses people of, well, I think I just have my allergies, or do I have something else? If you have a fever with it, that's definitely a time to get a test. But also if, well, this doesn't feel quite like what I usually get, that's another reason to go ahead and test yourself.
Okay, so let's say you test yourself, someone in your family, you're positive. What's the CDC recommending? What do you recommend? What do people do, I guess, to try to handle the symptoms?
So for fever and the achiness, using things like acetaminophen, ibuprofen, that helps, which can be given to both children and adults. That will help with that. You can use some of the decongestants, nasal sprays to help with the congestion. There's over-the-counter cough medicines that will help with the cough. So it's basically treating the symptoms. Now, if people are immunocompromised or really feeling bad, we do have medications. The most common would be the Paxlovid, but you need to make sure you get that within the first 5 days of your symptoms for it to be effective. So we do have some things that can help treat and also sort of treat the symptoms. For most people, it's just treating the symptoms.
And doctor, you referenced, immunocompromised. We know there are some sectors of the population that are more vulnerable to COVID-19. So what would you tell them as far as precautions? What should they be doing right now?
For the ones that are immunocompromised, whether they're in cancer treatments or they have genetic disorders or the other issues that transplant patients, anything that can actually cause you to be immunocompromised. Also, people over the age of 65, they group those together. They're more likely to have severe cases. So what we're saying is make sure you're keeping up with your vaccinations, and also, as I said, wearing your mask, being careful of going into really crowded situations. We know people want to go and visit families and have the family reunions. If they can be outside, although Houston's weather may not be the best for that, but if you can have it outside, that's safer than having it inside.
Okay. And anything that parents should know as far as younger children, when should they go to see their doctor? When is a good idea to test if they're worried about symptoms?
Yeah, with the young children, basically, if they start having colds or anything else, especially if they have fever, you definitely want to get into your pediatrician to talk to them about it, and they'll decide, do we test? Some pediatricians do, some don't, and they just sort of treat because they can't actually give some of these medications, like I mentioned, the Paxlovid, to children. It's not approved, so you treat the symptoms. Usually kids, as they do most things, they bounce back quickly, but we still have to remember that they can cause other people to be infected, so that's why you have to be careful with them.
Absolutely. Well, Dr. Sheppard, thank you so much for joining us this morning and for your perspective and knowledge on the topic. We appreciate it.
All right. Thank you, Brittany.